Hello everyone. Okay, this is going to be the video regarding my trip to Florida, meeting the doctor and his controversial treatment for tinnitus, which I have had, and my thoughts on this treatment. Okay, so I'm going to talk about what was actually done, how it was done, did it work, and my thoughts on this treatment. Alright, so I'll get straight to it. I met with the doctor and we had a brief discussion about the reasons I believe that I've been struck with tinnitus, high levels of stress, etc. You've heard me talk about this. So I gave him my thoughts on why I've been struck with tinnitus. His theory, or his belief, because this is what he believes, is that the fact that I have suffered 3 motorcycle accidents is really relates to why I have been struck with tinnitus. And his belief is that regardless of the initial reason, the injury that I have sustained to my neck directly relates to my intensity of my tinnitus. Okay, and he's talking about the area at the top of the skull, the COC1 and the COC2 joint, where the spine meets the skull. This is the area that he treats. And this rings true with me because this is the area that when I have craniosacral therapy, when my therapist applies pressure to this area, it alters the pitch and tone of my tinnitus. It actually changes it while he's applying pressure to this area. Also, when Amanda massages that area of my head at the back of my skull, it also has the same effect. So there's something going on there. So that rings true with me. So this is the area he treats. Now, what was the treatment? The treatment was 2 injections to these 2 joints in that area, and he injects a steroid called dexamethasone. Now this steroid is used to prevent inflammation within the body. It's also used for a number of different conditions. It's got a wide use. It's used for lupus, psoriasis, arthritis, breathing disorders, many different conditions. This drug is used for many different conditions. But the use of it for this treatment was to release and disperse scar tissue, around these 2 joints, and calcium build-up from the motorcycle accidents that I'd had. So he injected me in these 2 areas. And he said to me, okay, take a seat. So I'm sitting there, and he said, you'll know if it works within a few minutes. It's going to be that fast. And I sat there, and when I walked into the clinic, my tinnitus was a good solid level 2. Not terrible, but a good solid level 2. I was noticing it. So it was there, and I was noticing it. So I sat there in his clinic. And at first I thought, this isn't working, nothing's happening. And I looked at the doctor and he said, any reduction? I said, no, I can still hear it. And he said, okay, we'll give it a couple more minutes. And then, I would say within another 2 minutes, where I had the tinnitus was filling my whole head, at this level 2 was filling my whole head. My left hand side, within about 2 minutes, was completely clear. It was clear. Now my tinnitus resides usually in the right side of my head. That's how it always feels. So it's predominantly the right side that I feel it in. But on this day, like other days that I've had, it had filled all of my head, this level 2. So as I say, within 2 minutes the left hand side had cleared, and I looked at the doctor and I said, right, this side is clear. So he said, right, let's give it a few more minutes. And I sat there again, and I could still hear it in the right hand side, still a level 2. and then it started to come down. It was noticeably coming down in volume. And he looked at me and he said, how's it now? And I said, right, well, it is coming down in this side, but I can still hear it. I can still hear it. So he said, right, give it a couple more minutes. So I sat there again, and Amanda was in the clinic with me, and she could see a big smile across my face because it reduced it right down. It did come right down in this side as well. So this side was completely clear, and this side of my head, the right hand side, my tinnitus was there, but it came right down. It was way in the background, like just about a level 1. It was there, but it was way down. So something had happened. And the doctor asked me again, how are you? And I said, right, it has reduced. It has reduced. It's still there. I can still hear it, but it has definitely reduced. So the doctor said, okay, that's good progress. Okay, go away back to the hotel, and if it returns, give me a call and we'll see you again. So that's what I did. But something had gone on. So I went back to the hotel, and it was still early morning. So myself and Amanda decided to have something to eat. So we sat in the hotel, and I was having something to eat with Amanda, and at some point the tinnitus disappeared. I could not hear it. I could not hear it. And I looked at Amanda and I said, I cannot hear this. I cannot hear the tinnitus anymore. It has gone. Now, I have to be careful here. Whether this was due to solely the treatment that I'd had, these injections, or the fact that, again, I was in a situation like when I went to Yarmouth, where I was feeling relaxed, and in feeling this relaxed, my tinnitus came right down by itself, as it did in Yarmouth. I don't know. But sitting there at that table, after having had this treatment, I could not hear my tinnitus. So I said to Amanda, right, as wonderful as this is, I'm not going to get too elated about this, because, you know, I'm not sure if this is the treatment or this is just me or what's going on, but at the moment I cannot hear it. Now, for the next, we went out that day. We went down to the shopping mall down there on Delray Beach. So we were looking in shops. I did not hear my tinnitus for a good 5 to 6 hours. I didn't hear it. However, as the afternoon into evening went along, it came back, and my tinnitus came back. And in the night time, when it got to the evening, I said to Amanda, I said, it's coming back. I'm starting to hear it again, and it came back. And by about 8 o'clock in the evening, it was a full-blown level 2 plus. It came back, and I would say, if anything, it was probably worse than when I first arrived. So it had gone up. It was a good level 2 plus. Yeah, noticeable, irritating. Now, I don't know, it probably felt worse because I'd gone through the day without hearing it, those hours that I'd had during the day without hearing it. So when it did come back, it may have felt worse than what it actually was, but it felt like a 2 plus touching into a 3. So it wasn't good. Right, so that's why I think I was right not to get too elated by this. So the next day, we phoned the clinic to to make another appointment with the doctor, and unfortunately, because I wanted to pursue this further, unfortunately, this doctor is 80 years of age, and he's been practicing for 55 years, and he is not in the best of health. And unfortunately, the week that I was there, this doctor retired from his practice. I spoke to one of his colleagues, and unfortunately the doctor had been taken ill. His clinic was closed, and his son, who's also a doctor, had come down and closed the surgery down, and the doctor has unfortunately retired from practice. Couldn't make it up. So I spoke to one of his colleagues, and they said yes, unfortunately the doctor has retired. He is now going to be living in Arizona, and he is no longer practicing. So unfortunately, I couldn't pursue a further session of treatment with him. Would it have worked? Would it have been just temporary? Would it have been a permanent thing? I can't say, because I never got the chance to have a second session of treatment. But what I can say is, this treatment that I received, although it was only a temporary relief, and how it worked, I do not know. And I don't really think the doctor really knows how it works. But what I can say is that for a temporary period of time, this treatment, whatever it did, took away my tinnitus from my conscious thought. It was not present. However, it did come back. And when it did come back, it was slightly worse than it was before. So, who is this doctor? Okay, the doctor's name is Dr. Panozzo. Dr. Panozzo of Delray Beach. Now this doctor, as I say, he's 80 years of age. He has come under a lot of criticism, mainly from people who haven't actually met with him. I can understand why, because we in the tinnitus community, we don't, there's a lot of scams out there. There's a lot of, unscrupulous people trying to make a profit from our condition. So these people do exist. And this doctor has come under a lot of criticism, as that he's been called a quack and various other things like that. But this is usually from people that haven't actually met him. They've just seen his videos and decided it's rubbish. Well, I don't think it is rubbish. I think he is onto something with this treatment, because it definitely did something. It had an effect. As I say, he's 80 years of age. He's no longer practicing. So I was one of his very last patients to see him. I was one of the very last patients that got to see him. Now what I'm going to do, after speaking to one of his colleagues, I am going to try and contact the doctor again. I'm going to write to him. Whether he writes back or not, I don't know. I can only try. And I'm going to ask him if he would kindly send me information on the treatment, how he thinks it works, etc. And I'm going to try and contact some UK doctors to say, I think this needs to be looked into. There's something in this. That's basically all I can do. It's I mean, the fact that he retired the week I was there, it's as I've said in some of my other videos, sometimes life just comes along and throws crap at you, and there's nothing you can do about it. Yeah, so he has retired, but I will write to him, and I will try and contact some UK doctors, and I will try and say, look, I think this needs to be looked into. Whether they do or not, who can say? But I think he is onto something with this treatment. There is something in it, even though it only worked temporarily for me. Also, what I will do is I'm going to post some links at the bottom of this video from his own YouTube channel. There's a couple of patients that have tinnitus in these videos. One man who's in this video, this guy, his tinnitus was so bad, he considered, you'll hear him say in the video, he considered putting a gun in his mouth and blowing his brains out. That's how bad it got. And you know, I know there's a few of you out there who have felt the same. I know how I felt when it was at its worst. And this guy was at that stage. It was that bad. And you will see in the video, the doctor performs his treatment. He does the injections. The guy, at first he says, yes, I think it's reducing. I think, just like me, I think it's reducing. It's difficult to tell. And then, yes, it's reducing. It is reducing. He leaves the clinic, still with his tinnitus, but it's reduced. But he comes back, and you will hear him say, it's the most relief he's had in 3 years. It's the most relief he's had in 3 years after having this treatment. There's a couple more. There's a woman on there. It's a little bit like a Woody Allen movie, this video with this woman. The doctor's banter between the two of them, it's a little bit like a Woody Allen movie. But she's very sceptical to begin with, but you'll see when she comes back, she's dancing and she's saying how great she feels, and it's the best she's felt in years. And there's another video with another woman who had it as well, and they both seem to get good results from it, as I did. Unfortunately, it was only temporary. So, my thoughts are, the treatment has an effect. Whatever it did something, albeit only temporary. I would have liked to have pursued it further, but unfortunately, as I say, the doctor has now retired from his clinic. But I am going to write to him, because I think this is worth, I think it's worth further investigation. So, yes, the bottom line of this is, I still have tinnitus. It has not cured me. I still have it. Today it's been like a level 1 to 2. Last couple of days it's been a level 2 plus. So I still have the condition. It has not cured me. Or it did not cure me, but it did something temporarily. Without question, it had an effect. And unfortunately, this doctor, as far as I'm aware, is the only doctor that is performing this kind of treatment, as far as I'm aware. And unfortunately, he has retired from practice, so this treatment may be lost unless it's pursued. So I will try and write to him, and I will give you updates on if I make any progress with this. And yeah, so that's it, guys. That's it. That's all I can tell you. Like I say, I would have loved more than anything to have come back from this trip and say to you all, this treatment cures tinnitus. I would have loved nothing more. But I'm afraid I can't say that because it didn't. Okay, so I'll keep you updated on any further progress I make with this if I find out anything else. But in the meantime, best wishes to all of you. Best wishes. Best wishes. And I will see you again soon in my next video. Thanks very much, everybody. Bye-bye.